Thank you for joining us for today's webinar, Emotional Wellbeing, Warning Signs and Resources. Your presenters today are Jesse Ketterman and Jeanette Jeffrey with the University of Maryland Extension and Mariah Papinas with University of Delaware. I'm Taylor Robinson, and I'll be helping to facilitate this session. We will be using the chat pod located at the bottom right-hand corner throughout the presentation. For questions, please use the arrow key and select all participants and type your question in. We will be answering questions at the end of this presentation. Before we begin, I would like to say thank you to our sponsors and collaborators listed here on the slide. The blue link listed, which is extension.umd.edu/womenandag, is where you can find the complete list of upcoming and previously recorded webinars, as well as additional resources. As a reminder, we will be recording this presentation, and you will receive an email with the recording and PowerPoint slides. At this time, I would like to turn the presentation over to Jeanette Jeffrey with the University of Maryland Extension, and we're happy to have her here today.
Thank you, Taylor, and thank you all participating on today's webinar. My name is Jeanette Jeffrey, and I serve as a family and consumer agent with the University of Maryland Extension, along with my colleague Jesse Ketterman. Maria Papitas also serves as a family and consumer extension agent with the University of Delaware. The purpose of our discussion today, let me just get this there, is farmers experience a wide range of emotional stress that can affect both the individual and their family. This session will share warning signs and resources available to deal with emotional stress. Some topics covered include financial stress, substance abuse, depression, and suicide. So, before we move forward, let's lay the groundwork with a definition of stress and a foundational understanding of its effect on the body. There are many definitions out there of stress, but to give credit where credit is due, the term stress was first coined by Dr. Hans Selye, who's both an endocrinologist and a biologist, who through conducting studies on laboratory animals found that there was a recognizable pattern in response of the body to a stressor being those things that initiate the stress response in the body. Dr. Selye in 1936 defined stress as, quote, the nonspecific response of the body to any demand for change. The stress response is systemic. It affects the entire organism and is not just targeted to one specific area in the body, as I'll further explain in an upcoming slide. Dr. Selye also found that the body reacts to a stressor, be it good or bad, in the same way. The stress response is the same. This realization led Dr. Selye to further differentiate stress as eustress, meaning good stress, and distress, meaning bad stress. Eustress is typically acute, meaning short term, and serves to prime the pump, if you will, ensuring that our stress response is on the ready, since we as humans would never have survived as long as we have without being able to identify and react to stressors. Distress, on the other hand, can lead to illness and even death if not relieved. Chronic stress levels are directly related to chronic stress or chronic disease states. If we look, examples of eustress are things like exercise, a vacation, a wedding. Distress, on the other hand, are things like finances, relationships, injury. But also, let's understand that one person's eustress may be another person's distress. And this reminds me of when I was a young girl. I have 3 brothers, and our big trip was down to the ocean each summer. And my mom would pack up the car. Me and my 3 brothers would pile in the car. And where was Dad? Well, he was in the bathroom getting sick. The rest of us were, yay, this is eustress, this is fun, we're going on vacation. And Dad was thinking, I'm going to be away on vacation with 4 screaming kids and 3 hours in the car. Not as much of the eustress on his end as distress. But all that to say that the body is going to react the same way, whether it's eustress or distress. And Dr. Cellier found that there was a predictable pattern that animals, including humans, react to stress, which he outlined in the General Adaptation Syndrome, also known as GAS for short. And you may have found that stress absolutely can cause gas in an individual. It can affect the stomach and lead to all sorts of digestion issues. But this general adaptation syndrome, outlined here in this slide, shows three distinct phases. So, that first one, say that you had to be up bright and early this morning. Prior to going to bed last night, setting the alarm would have been a good thing to do, especially if it's a time you're not used to getting up. That's exactly what's happening in the general adaptation syndrome when your body is hit up by a stressor. Again, a stressor is that thing that causes the stress response syndrome within your body. So, phase one, brrring, the alarm goes off. In that alarm phase, your body is trying to mobilize all of its resources to try to cope, to try to deal, to react to that stressor. This is that phase that's known as the fight or flight response, and I'm sure that you've all heard that at one point. So the fight or flight is at the alarm stage, and I'm going to get into that a little bit more in the next slide. But what you see in the middle of that slide there, there's a line. And in science, we refer to that line as homeostasis. Basically, it's just where everything is at balance. Nothing is too high at the hyper stage or too low at the hypo stage. Our body is always trying to return to a state of balance, a return to that homeostasis. But now we're at the stressor, that we're at that alarm phase. We need to react. And so what you see now is that the body's reaction goes beyond, up above that line of balance. And we enter into that second phase, which is the resistance phase. Here we're trying to cope with that stressor, and it's an overshoot. And our body is constantly trying to bring us back into balance. That's okay. If it's eustress, if it's acute, meaning short term stress, our body will be able to bring it back down to that homeostasis level, to that flat line across the screen there. So if it does, all is good. We've just primed the pump, as I said. We made sure that that stress response is working for us, so when we need it, it will be on the ready for us. But think about this. If you are under chronic stress, that stressor keeps hitting you over and over and over again, and it could be in different forms. It could be a broken down piece of machinery. It could be the weather. It could be a bill that's overdue. If it's unrelenting, this stress is coming at you, the body is constantly trying to resist. After a while, the body gets exhausted, and that's when we're into phase three. That exhaustion phase with chronic stress leads to illness, also increases risk of injury, and it can eventually lead to death. As I mentioned earlier, chronic stress is directly related with chronic disease states. And so, without being able to relieve the stress in our lives and bring it back down to balance, that illness, injury, can eventually lead to death in that exhaustion phase. Looking at the stress response, as I said, I wanted to get into this a little bit deeper. Let's look to the left hand side of this diagram here. When we take in information, we take it in through our senses, our eyes, our nose, our ears, touch. All of that information goes to the outside of our brain. But we have to make sense of it. So, what happens is chemical messages are sent by all of those senses from the outside of the brain to the very inside of the brain. And that's what number 2 on the left hand side is showing. The very inside of the brain, you have what's called the pituitary gland. And the pituitary gland sends out a whole lot of hormones. And what hormones are just chemical messages. They allow your body to understand what's going on and to react. So what happens is that sensory information from the outside of the brain goes to the pituitary gland, and the pituitary gland is going to send out a hormone called ACTH. and that is going to go out into the bloodstream. Remember that definition that Hans Selye gave of stress, non-specific response of the body. And that's what we're talking about here. It's a systemic response. It's happening all over the body. It goes through the bloodstream, so now it's going to every organ in the body. The specific organ that's going to react by releasing more stress hormones are the adrenal glands. So if you look at number 3 and there's an arrow that points, the adrenal glands are located right above your kidneys. And the adrenal glands are going to release 3 hormones that are what we refer to as stress hormones. And you probably have heard of them. Cortisol. Cortisol has been given a lot of attention recently. Cortisol levels, when high, increase risk of cancer. And we've looked at cortisol levels, particularly in females, high levels with an association with breast cancer. Cortisol levels that are high also increase fat deposits in women, particularly around the abdomen. So that tire that we can also often accumulate, particularly after menopause, is related to high cortisol levels. The adrenal gland also releases 2 other stress hormones, epinephrine and norepinephrine. Now, you may be thinking, I don't know what they are. Well, I'm sure you've all heard of adrenaline. Adrenaline is the same thing as epinephrine. Epinephrine is just a snazzy word for adrenaline. So, adrenaline and noradrenaline, also known as epinephrine and norepinephrine, those hormones are released every time your body faces a stressor in that alarm phase, getting your body ready for that fight or flight. If we move down to number 4, as it states, stress hormones are now going to travel through the blood to target the cells, and they're going to trigger the conversion of stored fat, protein, and carbohydrates to glucose. Let me explain that just a little bit more. When we eat food, anything in excess is going to be stored as fat. But also, when we eat food, our body also wants to ensure that we've got a backup supply of energy, especially for times when our body is under stress. Say that there is something coming at you to do you harm. You can't say, hey, wait up. Let me go sit down and have a sandwich so I can get some calories and then I can fight you off. Nope. The body ensures for a state of survival that when we eat, part of our food is going to be stored up in our liver and as our large muscles. So that's what we're talking about here. When we've got that release of cortisol, adrenaline, and noradrenaline, also known as epinephrine and norepinephrine, it's going to trigger that stored up energy to be released because all of our cells need to be fed. And that energy also needs to go to the brain because you need to be able to think quickly and react even quicker. So then on number 5, the stress hormones, as we've already said, prepares for that fight or flight. So let's look over on the right-hand side and see exactly what's happening in that alarm stage, also known as fight or flight. Our hearing becomes more acute. You actually can hear better. And that's why, like at 3 a.m., when the house is quiet and it's dark and every little sound becomes amplified, if your body is under stress, you're taking in as much sensory information as you possibly can. Also, more blood is flowing to the brain. As we said, we need nutrients up to the brain. Also, blood carries oxygen. The brain needs to be able to react quickly. Your pupils actually dilate in size, again, bringing in more sensory information. Perspiration increases. What do they say? That horses sweat, men perspire, and women glow. Well, some of us women, me included, glow a little bit more than others. But perspiration is one of those things that when our body is under stress, that a whole lot of heat is being generated inside of our body because of the processes that are going on. That heat needs to be dissipated. How does it do that? We perspire. Our respiration rate increases, meaning we breathe more quickly. If you ever realize when you're under stress that that is your body trying to take in more oxygen. Remember, all of your cells need the oxygen. Your muscles have to react. They need oxygen, and the brain needs it. Your heart rate and your blood pressure increases. Also, your liver and fat tissues release that energy, just like we talked about. That's where it's stored. No time for storage now. We throw that out as glucose, blood sugar. You've heard of that. That's going to feed all of our cells so that they can work very well for us and quickly. Digestion also halts. When we talk about digestion, there's two parts of digestion in the stomach. One is chemical digestion, the hydrochloric acid that's found in the stomach that breaks down our food. But there's also mechanical digestion, and that's when the walls of the stomach grind the food that's in there to break it into small pieces. But that grinding of those stomach muscles takes blood. But when you're in that fight or flight response, we don't need the stomach working for us right now. We need that blood in our large muscles to fight or to run away and save ourselves for another day. Urine production is also decreasing. More blood is flowing to the muscles, as I already said, and your muscles tense up. The immune system is also initially activated. If you get cut, you've got a whole lot of white blood cells that are on the ready so that if any infection occurs at that site, then they are there. They are ready to attack. And then blood clotting ability is also increased for that same reason. You get cut, the body needs to clot the blood at that injury site in order to ensure that you don't bleed out. This is amazing when we're talking about the alarm stage. But I want you to stop and think. If this is going on over and over and over again, day in, day out, unrelenting, unceasing stress, stressors are compounded, and the stress response is going on and on, eventually the body is no longer going to be able to function properly. Again, that's when we go into that stage of exhaustion, illness, and that can lead to death. So at this point, what I'd like to do is turn our discussion over to Maria, who is going to talk more pointedly about farm and stressors on the farm. So let me just move forward, and I'm going to pass it over to Maria. It's all yours, Maria.
Thank you, Jeanette. That was a really wonderful overview of how stress really impacts the body. And and we can see really how both sort of ordinary stress and extraordinary stressors can really impact us differently. And that's really what this next slide is about, is there are things that are sort of ordinary stress, like managing our busy lives, managing health issues, accessing health care when you need it, managing finances, the dynamics within the family, and certainly issues around farm production and management. And many individuals share that, these are sort of the normal things in our life that we create to help us manage and live our lives. And sometimes they induce some stress. Then there are those things that might be extraordinary stressors, like weather events or volatile markets or rising interest rates, things that really can impact the farm's ability to be productive and profitable, but that impact us individually as family members or as farm operators, that can also spill over into our other family members. And so, again, how we are able to manage these stresses and prevent them, if we can, really impacts our body's reaction to stress. So one of the things that I think is really important for us to share is that really many of the cooperative extension programming that we do is really about how do we create thriving farms and a thriving family. And that family may also include farm workers, right? So farm operators and family members and their workers, we want to create thriving farms. And this little visual on the right-hand side may be a little difficult to read, but what this silo represents are many of the factors that really impact the farm. And when these things are in place and properly managed, right, we can anticipate a thriving farm. And so, from a health and stressor perspective, things that we can control are mostly on the bottom half of this silo, and things that may be less that we have less ability to control are kind of on the top part of this silo. And so as we conduct educational programming around stress management, we're thinking about things a lot on the bottom half of this. What is it that we can potentially control and put in place preventative measures so that we can reduce stress? So things like income, having off-farm income helps offset farm income, especially when farm income may be lower, right? Our health and safety, yeah, is something that we can control and take care of so that that doesn't add more stress. Certainly the farm business and risk management practices and our capacity to learn and to adapt to change, all of those skills and strategies can help offset stressors and help build a thriving farm. Access to health care, meaning, how close is it and whether or not you go, right, as well as health insurance. Those are important pieces that can help reduce stress if they're in place. And then things like different kinds of insurance and having emergency funds and savings to help offset costs of care or loss, those can really help manage stress better. And so as we go up, we're talking about family communication, having social support networks and mental well-being. All of those pieces really help in terms of putting pieces into place that will create a less stressful environment as well as a thriving farm. And so we talk about trying to create a thriving farm and reducing emotional and mental and physical stressors. In extension, we often use ag risk management strategies to talk about the production side of our farm, but we're less likely to talk about kind of resiliency factors that help people cope with change. And so oftentimes we're doing this. We just not may be conscious that we're doing these. And once we're conscious of them, we can use strategies to try and enhance them. So here are some of the things that I know on the left-hand side we use to manage stressors from an ag production and risk management strategy. And so the risk management areas like production, marketing, financial, legal, and human. And so some of the strategies that you learn in many of the Women in Ag programming really address lots of those things. On the individual and family stress management practices, things like working towards effective communication, exercising, eating right, all of those pieces, as Jeanette was sharing, you can see stress really impacts us physically, impacts our bodies. And so things like exercising and eating right are ways to combat stress because it keeps our body healthy. Certainly taking care of your physical and mental health is also important for maintaining stress. So if you have chronic stress, it can start to manifest in chronic disease like diabetes, like heart disease. And so it's important then to make sure you're taking care of yourself physically. And if you have those chronic uh, um, diseases, to really connect with your doctor and making sure you're taking care of yourself. Continuing to learn and adapt is an important stress management strategy. And part of the way to do that is having a good support network, whether that's family support network or a professional support network, helping you keep on top of things so that you know how to handle especially those extraordinary stressors that come. And then, of course, using techniques that manage and reduce stress. So simple things like breathing, like exercising, like visiting with friends, doing things that have nothing to do with the farm, gets you out of your head a little bit, is are great strategies to help you help reduce stress. So here's an opportunity for you to share. And what we're looking for here is your ideas about what are signs of stress on the farm. In other words, what might be some things that you see on the farm that are signs that there may be some stress happening at that farm. And so, again, you want to write in the chat box, and where you see the little 2 and the down arrow to the right-hand side, choose everyone. And so then everyone can see your response. So let's just take a minute, and you all just give us some ideas of what are some of those signs of stress on the farm.
Now, I know at least one person indicated to me that they don't have the all participants option. If you don't have that, just click on host and presenter and type your response in there, and then we'll share that with everyone as you type it in.
Thanks, Tracy. So thank you. We're seeing things like anger and resentment about chores, injuries, certainly, isolation from the family, a good physical manifestation of things not going well on the farm not thriving might be that the fields aren't plowed, right? Or that maintenance isn't being done. These are great. Examples. Yes, the gardens aren't tended, the animals barely cared for, structures might start falling down or go into disrepair. And then many of you are offering kind of like physical manifestations for personal physical manifestations, like changes in sleep, you're irritable, you're angry, um, communication is difficult within the family, tend to isolate oneself, not go out, not enjoying formally enjoyable activities. That's right, like hanging out with friends or family. Fatigue. These are all wonderful, wonderful, wonderful examples. Kids running wild. Yes, Anthony. So there's not a lot of structure with the kids. But you also bring up a really great point, and that is sometimes for people who are in chronic states of stress, they don't even realize they're stressed out. But the kids sure do. And they may start showing signs of misbehavior, of not doing well in school, not going to school, kind of dropping out, because they're feeling the signs of the family stress. And so those are really great examples of of how, if one person in the family is not doing well, is stressed out, it can trickle over into all other folks in the family. No one wrote it, but it certainly is a sign. Increased use of alcohol, increased use of drugs. We've seen in the paper lots of comments about opioid usage. And so those are all great examples. Thank you so much for all of those um, signs of stress. Here are some of the ones we came up with, and I think you guys hit them all, right? Change in appearance of the farm, change in people's routine and behavior, especially if they start to isolate themselves. There may be an increase of illness and injury, and so that illness may be that chronic illness and that manifests as stress stays with us too long, or it may be in the sign of a depression or in signs of not being careful that may lead to injury because they don't care, or maybe they're using alcohol and then they're not paying attention when they're using equipment and whatnot. So, and then lastly, my comment earlier about children's behavior changes. So all of those are signs of stress on the farm, and certainly thinking about ag best management practices, but also what are some of those family resiliency strategies that help keep families and individuals strong are ways to combat these signs and stressors. So now I'm going to pass the ball to Jesse, and he's going to pick it up from here.
Thank you, Maria. And one of the things that, I'm going to be talking about some of these different areas, but I want you to start thinking about mental health and substance abuse issues the same way you would as if you weren't feeling well. What would you do? If you weren't feeling well, you would go to the doctor, right? If you experience mental health issues, then you also need to go to a doctor and get checked out, right? So it's the same kind of thing. Oftentimes, mental health issues can have a stigma, and we want to kind of move away from that because, again, even with mental health, there's kind of a spectrum there, right? There's good health and poor health and even stress, right? Stress can be good or bad. Right? If we have good stress can motivate us to do things. Now, having too much stress, again, can lead to poor health and all those issues that both Maria and Jeanette had mentioned earlier. The same when you think about alcohol. Alcohol, there's studies out there that say 1 glass of wine a day is good for your body. But we all know what happens when someone uses too much alcohol. The same with depression, right? We all experience forms of depression. Being depressed over something that happened is not necessarily a bad thing. It doesn't mean that you have the overall issue of depression. It just means that you are dealing with one particular issue and you can get over it and use that to motivate you and so forth. In the same falls as we talked, Maria mentioned the opioids, prescriptions. They can fall in that same spectrum. Prescriptions can help us get better. In the same case, abusing prescriptions can lead to poor health and help and make us end up in a worse position. So I want to start talking about some of these issues. So the first one, of course, is substance abuse, and I have a little definition here, and it's really the simple definition is the abuse or dependence of alcohol or other drugs. And so what are some signs that you might see when someone is abusing substances? So when it comes to alcohol, that's usually pretty visible because you see heavy drinking, right? And that can be both in the quantity of drinking that occurs and also in the speed at which people are drinking, right? And then some of the other warning signs that go along with it, if someone continuously drinks alone, well, that's kind of a sign that there might be some issues. When you see people that are drinking alcohol to cope with problems, That can be another example. Other warning kind of signs can be also over dependence on medication. So as you start to see some of these signs and you see someone that has substance abuse issues, I listed some services here that are available. SAMHSA has kind of an 800 number. They can connect you with local resources. One thing that I didn't put here on the slide was your local health department. Your local health department, if you go to their website, and you can type in your county health department in a web browser and it'll pull up there, they're going to have some substance abuse resources that are available to you. Some other ones that I mentioned here on the site are Alcoholics Anonymous, Narcotics Anonymous. So there's resources out there. Any kind of counseling center is going to help you with these types of issues as well. What is depression? Depression is that feeling of sadness, hopelessness, worthlessness, and it usually lasts over a period of time. So like I mentioned earlier, you may be depressed about a situation or an incident, but when it goes on for a long period of time, you're looking at depression, and you need to look at what resources are available to you to help you through that. And so what are some of the signs? Feelings of guilt would be a sign of depression. Irritability would be another sign. A person changes their interest in something, so all of a sudden they have this lack of interest in things in general. Not engaging with other people. So if I used to go to McDonald's every morning and had coffee with the other farmers, and all of a sudden I stopped showing up, that would kind of be a warning sign that something is happening with me, that someone, those other people that are there might want to reach out and try to figure out what's going on with that person. You can also see impacts with your sleeping, weight change, and also having difficulty to concentrate. And so some of the resources that are out there, depression and suicide are different, but there are similar resources for both of those issues. So, the National Suicide Prevention Hotline, there's the number on the screen for that. That's a great resource. They also have a website that shares information that you can use. There's a crisis text line. So again, younger millennials and younger farmers, they're probably going to be more likely to text than they are to call a number. That's just how they live their life. I also had a number on the screen for the National Alliance on Mental Illness. Again, same thing. They're going to have a variety of resources. You call this number, they'll connect you. And I also have some resources at the end that I'll list as well. So suicide, of course, suicide is the act of intentionally causing one's own death. You don't want to refer to this as someone that has successfully committed suicide, because there's nothing successful about it, right? So it's someone that is causing their own death. And what are some signs of this? When you look at that, you're saying, you're going to see people that are talking about wanting to die. You're going to hear them talking about feeling a lot of guilt, that they feel like they're a burden to others. You're going to see them withdrawing and isolating themselves. They may talk about death often, right? More frequently than they had in the past. They may start giving away their possessions, things that have some kind of emotional, sentimental value to them. Next thing you know, they're handing these things, hey, I'd like you to have this, and I'd like you to have this. That would be kind of a warning sign. And then also just kind of saying goodbye to family and friends. So if you see someone that's kind of saying their last goodbyes, that would be a sign too. And so I've provided, again, the similar resources, the National Suicide Prevention Hotline. That number's on your screen, as well as the crisis text line. Now, the one thing I want you to know when it comes to suicide, some people are worried about this, but it's okay to ask someone, hey, are you having thoughts of suicide? Because, if they are, they're likely to tell you that, yes, I'm thinking about that. And if someone does say that to you, don't leave them. At that point, you need to get them professional help. So whether that be, calling that crisis hotline, or the text line, it could be calling, taking someone to the hospital, could be contacting one of their closer family members and saying, hey, this person, they need some help right now. Could you get over here right away? And then you can decide what direction to go in from there. But again, at the least, call that National Suicide Prevention Hotline. So, there's a course out there called Mental Health First Aid. Jeanette and I went through that. It's offered nationally, so it's a good thing if you think you want to kind of get some more training on this issue. It's a day-long training. Encourage all of you to do that. The site there is mentalhealthfirstaid.org. But they kind of go through these steps, and they call it ALGE. And first the first thing you need to do is assess the risk of suicide or harm, and that's that piece that I was talking about in terms of, you can ask them, hey, are you thinking about hurting yourself? Are you thinking about suicide? And again, if they ask, then you need to get those resources right away. Listen non-judgmentally. So you want to someone's sharing with you, don't be judgmental. Don't say, well, don't talk like that, or, hey, I understand what you're going through. Let's see what we can do to help you. Just that active listening component, listening to what they have to say. Give them reassurance and information. Hey, we're going to be able to get through this. We're going to work through this. Everything's going to be all right. Everything will be fine. Encourage appropriate professional help. Sometimes people say, I'm thinking about this, and I just don't want you to tell anyone. You don't want to make promises that you can't keep. And so if someone's hurting themselves, you need to get that help, and you need to know that, there are limitations to to what I can do, because I don't have the same training as someone that is trained on mental health issues. And, the other E there is encourage self-help and support strategies. And, we're going to talk about a couple of those strategies here on my next slide. But again, what you want to remember is this ALGE. Assess for risk, listen non-judgmentally, give reassurance, encourage appropriate professional help, and encourage self-help and support strategies. So what are some stress management strategies? I listed a couple things you could do here. I also listed a fact sheet produced by North Dakota State University, and they have a whole comprehensive list of things you can do. And so you're going to get a copy of the PowerPoint, so you'll have access to this internet resource. But if you wanted to type it in and look it up, you could. Again, talking to others, that's a great way to address stress. You have that social support. You can talk through problems with others. You can also learn about other ways that other people have dealt with stress-related issues. When it comes to relaxation techniques, breathing is a big thing. Right? If you just take a minute to clear your mind, take that deep breath in and hold it, and exhale. If we were in an in-person workshop right now, we kind of practice that a little bit, but I think we're all familiar with it, right? You take that deep breath, and it increases the flow of oxygen into your bloodstream. It helps you think better. It makes you relax and feel better. So taking some time to relax with something as simple as a breathing technique can help deal with stress. And of course, there's other things you can do if you're into yoga or meditation. Those are all things that you can do that are relaxation techniques. Exercise, we all know that the recommended exercise is 15 to 20 minutes a day, anywhere from 3 to 5 times a week. But often we kind of, as stress builds, we kind of stop exercising. And even something as simple as going for a walk every day can help manage stress. And of course, when all else, when you're not sure what to do, you've got to seek professional help. There is a lot of help out there, and now we're going to kind of turn to that question, and I'm going to ask for responses, but wrong way.
Hey,
Where
hey,
do you turn
Jesse.
Yes, go ahead.
Jesse, this is Maria. So, just the other day, I learned a different kind of breathing technique that I think works really well for people who are anxious. Because oftentimes we can feel anxious, and somehow like taking deep breaths just doesn't cut it.
Right.
And so this technique was interesting. It's called the bunny breathing technique. And so you sniff in 3 times through your nose very quickly and hold it for a beat, and then you exhale. So it kind of goes. And I've practiced this with my 12-year-old niece, and who is anxious a lot. And so it really helps to transition into some more normal thinking and breathing patterns. So I just wanted to share that because it's different than just trying to breathe.
Right. Well, thank you. Yes. Yeah. And I even noticed, that breathing technique, that's something I do before I go to the doctor's office. I always do that because of the blood pressure. I'm always paranoid my blood pressure is going to be high, and my nurse practitioner is going to yell at me, and I have to say, all right, relax. I get into my chair and I relax and take some deep breaths, and it is helpful. So, but where I wanted to turn next is, if you're dealing with some of these issues, whether it's stress related or mental health related, where do you turn for help? So I want to see some responses in the chat box. Where do you go for help when you're dealing with some of these issues? And again, it can just be stress and how you're dealing with stress, or it can be these issues in particular that we mentioned around depression and suicide and substance abuse, or those financial stressors that we were talking about earlier. So that's where you go to your keyboard. We talk about going on walks and talking to neighbors. Yeah. I want to reinforce that extension office, right? If I'm not sure what what the situation is and what I should do, there's a lot of different resources with an extension office, whether it's talking to an ag educator or whether it's talking to a family and consumer sciences educator. I think about, talking to a pastor. That's another resource that's out there in the community that you can talk to.
Hey, Jesse.
Your healthcare provider. Yes.
This is Jeanette, and while people are giving responses to this, I just wanted to go back with the suicide. As we both know, that oftentimes, or sadly but true, some folks will never even voice that they're feeling suicidal. And that's when we talk about the icky side of suicide, is that you may think that everything is going fine and with your friend or even someone that lives with you and be totally caught off guard if they've chosen to take their life. So this is where we always want to make sure that we're also practicing self-help and self-care. So there are resources out there available, all the ones that Jesse provided, if you are someone who is dealing with the death of someone by suicide. And so please ensure that you're taking care of your own health and well-being, and particularly when it comes to families, because we do see that children of parents who have died by suicide are at a higher risk category. So like Jesse had started out the conversation, we want to minimize the stigmatization and discuss these things and be able to make sure that we are getting the self-care that we need.
Very good point. Thank you. Thank you. A couple other things that popped up in the chat area, sometimes when you feel overwhelmed and there's so many things to do, just by making a list and a to-do list and even prioritizing that list, just writing it down helps you kind of feel like a sense of accomplishment when you can check those things off the list. someone mentioned talking to go into the social media, and again, that's fine. Just making sure that, again, that there's someone out there that you can talk to or vent to, and just making sure that, again, you just want to bounce ideas off of someone, and you're going to see the internet more and more today with those types of things. And a couple resources that I thought I would share here. You have the Farm Aid Hotline, the Farm Crisis Center, Mental Health America. There's some good resources there on Mental Health America. There's some screening tools that you can use for a variety of mental health issues. There's also resources there in terms of finding a local provider. So all good pieces of information there. Both in Maryland and Delaware, we've created some resources. So in Maryland, the University of Maryland, we have our farm stress management site, and there's the website for that. And you can see we've broken that into 3 different areas. We have some financial resources, stress management resources, and legal resources. And so even in that stress management area, there's some ways to find local providers there. Again, a wealth of information that's been gathered there. In Delaware, we have a website. Basically, this website spun out of some farm and health forums that we had back in the fall, and the library system in Delaware created this site specifically for farmers dealing with these issues. So you can see the titles there: farm financial management, farm family and health management, partners, resources for kids and terms. So again, 2 places that you can go to with local resources and good information around these issues. And I just wanted to pull together a list of resources that, again, places where you can go and get more information. Look this up. There's only so much that we can cover in an hour. But there, again, the website for the crisis text line. There's the site we just mentioned with Delaware Farm Families, Mental Health First Aid. Michigan State University has done a lot of work. Both Jeanette and I went through some training out in Michigan around farm stress management. They have a website with some resources. National Alliance on Mental Health. The National Institute of Health has a lot of resources there. Substance abuse, mental health administration, and I already mentioned the University of Maryland farm stress management site. That's our EEO slide. And at this point, we have our contact information there. If you have any questions you want to type in the chat box, you're welcome to do so. We still have a couple minutes, so if someone has a comment or a question that they'd like to pose or ask, feel free to do that.
Yeah, but I think it's safe to go ahead and stop the recording while they
Okay.
look at any questions that they have.